So I'd like to welcome everybody in this room. Looks like another nice crowd. And also virtually, I don't know what the attendance is. Yesterday we were hitting an all-time high virtual attendance, so that's great to see. Looks like we still have some people coming in. What I want to do is just kind of thank everybody for the participation yesterday. It was a great day. I received a lot of feedback and just a couple comments about yesterday. Today will be a continuation of the engagement and the excitement that we had yesterday on some wonderful topics. The case for quality in the collaborative community is really a unique platform, unlike others out there in our ecosystem. And summits like this and the great work that we shared yesterday and that we will share today are not possible without all of you and the ecosystem, the regulators, healthcare providers, industry itself, and mentors from other industries. So this has been a journey for many, many years. Some of you, I've noticed yesterday, have been engaged with the case for quality since 2011, 2016. So it really is exciting for me, being a newcomer with the collaborative community in MDIC, I think maybe over a year now, to see the great work that all of you are doing to advance patient medical device safety and take it to the next level of quality. So I really do appreciate, and I'd like a round of applause for all of you. Thank you. The other thing, it's impossible to put something like this together. For me, this has been out of my wheelhouse. So it's been really an experiment, and I appreciate the comments, but quite frankly, this is not just me. I want to recognize, and if they could come up front real quickly, some wonderful individuals in the Case for Quality team, some of the best professionals I have worked with in my experience in the last 30, 100 years, I don't know, but Desiree and Savannah, if you could just kind of come up for a second. So Desiree Steele, program manager, and Savannah Walker. So at any time, today or in the future, if you ever want to get engaged or if you have a question about what we're doing, reach out to any one of us, okay? And we are actually very, very responsive. Thank you, ladies.
Yeah, thank you.
The other thing I want to mention, I want to give a great thank you to Simona Rollinson. Simona, could you stand up for a moment? She's the COO with ISACA, and they were nice enough to help co-sponsor the wonderful event that we had after the day yesterday. Thank you very much. If you do have questions after the summit is over, feel free to send us an email, and we will either forward the question off to the panelists, or if we can answer the questions for you, we'll be happy to do that. Okay, and if you don't get a response, you can contact me directly, okay? All right, what are you smiling about? We'll send all the questions over to Cisco. All right, so it's my pleasure to kick us off with a wonderful individual, Zohair Mekri, Director of Engineering with a company called Flex, which is new to me. I have not heard of Flex until this summit. And he is going to present a little bit on a keynote speech relative to what we're doing in advanced manufacturing, automation, and practically the digital transformation of manufacturing. So with great pleasure, Zohair. You mic up?
I think so, yeah. Good to see you. Thanks so much. I just received a good compliment that I'm tall, so that I have to sit in front of the camera. Is that okay? Looking good? Okay. Good morning, everyone. So my name is Zohair Mekri. I am part of Flex, as Paul mentioned, and it's a pleasure to be here. It's actually my honor to be here, so thank you very much for having me. I am from California, so it was a nice flight to come in here yesterday and be a part of this lovely city. So I'm from a I'm from Northern California, for those of you who are familiar with California. I'm actually live in a small town. It's called Livermore, for any of you who have been to California at all. It's a really small town. It's in northern California. It's really natural. I love it. I've been there for a long time. It has a lot of natural beauty. There's hiking trails. There's biking trails. There's rock climbing. There's wineries. There's a lot of parks out there. It's a really, really, really beautiful place to be. It's very calming, very serene, very relaxing. And I live actually on a street. If you're in my house, if you were to cross the street, there's a really big establishment there. And many of you may have heard of it, but every single morning when I drive, I have to take a left and a right, and I'm driving past this huge building that looks really small, but it's a very famous building, and it's a really important building to me personally, because as you drive by it and you look to your left, you'll see a huge sign that will say Lawrence Livermore National Laboratory. And right below that, you'll see the old seal of Livermore. And that seal of Livermore, it has a horse for rodeo. It's a small town. You'll see an atom for technology. And you'll see grapes, because it's a beautiful wine country. And I see it every single day on the way to work, because I drive right past it, and it's absolutely beautiful to see this huge building with this advanced technology, and you're just driving through this mountainside. And it's really special to me personally, because what I do every single day started in that lab. So a long time ago, in the 70s, there was an effort in that lab to analyze what happens to things under force in a three-dimensional manner. Okay. So today, you look at any kind of simulation, you'll see that things are happening in 3 dimensions, right? Well, in the old days, they couldn't do that. They have to do it in 2D. But there was a person by the name of Dr. John Holquist there, a long time ago in the 70s, that actually was looking at how to make 2D simulations into 3D simulations so that they could see what happens when force is applied to different things. Over the decades of that initiative, that project, a lot of companies, a lot of government organizations, a lot of different organizations across the world in different ways were able to make that project into technology today.
No, because he's not.
That simulation technology is now used across multiple different industries. As a matter of fact, there's guidance on physics simulations from the Department of Transportation and other government bodies today. So that's a really good example of what happens when you have a really cool, useful technology that's advanced in its time, and it's contributed to by a number of different organizations. And the reason I bring up the seal of Livermore is right below where it says Lawrence Livermore National Laboratory, the seal of Livermore has 3 words on top. It says room for all. And the reason that's important is because as you think about how all the different organizations contributed to simulation over the last 4 to 5 decades, it's because there was so much room for so many people to contribute to it.
You good?
So what I'll talk about today is a different kind of simulation. We talked about physics simulation, which started right across the street from me. But I'll talk about a different kind of simulation, which is process simulation, which today is still, I would say, it's mature, but it's largely untapped, in my opinion. So I'll talk about how digital twin really contributes to that. Oh, perfect. Amazing. So as you can see here, we'll talk about a few different things. We'll talk about what really that technology is. I'll talk about a little bit more on what it means when I say simulation and digital twin. And then I'll talk about why it's important and why it's really important for us, especially in today's conversation, to think about it and how it relates to the things that we will work on as we leave from here, hopefully. And I'll talk about it specifically in terms of medical applications and how we're using it today. So I'll also give you a case study. And we'll wrap it up. And I hope to hear some good questions. My major motivation for the presentation when we're done here is really to let everyone know that there is a lot of room for us to collaborate. And that's really what I'm hoping to walk away with from here, which is that we have a chance to have some pretty good conversations. So essentially, just to kind of talk about simulation in general, for those of you who are not familiar with it. Simulation, we talked about physics simulation. I'm going to cover discrete event simulation. Discrete event simulation is essentially just the process of being able to model what's happening in the real world in an environment that's software, right? So if you look at any environment that you can think of that has steps, discrete event simulation just means simulating something that has steps. So 1 step, 2 step, 3 step. And it has defined steps. So it has a start and an end. And that's a discrete event. So when you take up all of the steps in a process, you can model them. In the real world, we see an assembly line. You can see that in any kind of line, really. You can see it at a queue. You can see it when you call for technical support. There's steps. Discrete event simulation is being able to use that in a software environment. What we do there is we actually take the real world and we see what's happening in the real world. So we take all the different information that's happening in the real world and we put it into the digital world. There's 3 things that make up the real world, as everyone here knows. There's space, there's time, and there's matter. And that's what we model. We model the space. So for example, this room. We'll model the walls, the lights, the floor, the carpet, the tables. We'll model the time. So we're modeling how much time it takes for something to happen. This presentation will take a certain amount of time. That's a discrete event. And the third thing that we model is the things in that space, the matter. So that could be the people, that could be the material, that could be the chairs, it could be whatever the stuff is in that room, in that space that you have. So when we model that, all those 3 things are related to each other. They're not independent, right? You're related to the people that are in this room in some way or another. And what you do in this room will affect someone else in some way. So that relationship has a mathematical algorithm that represents what happens. If you're sitting somewhere and you pass over a note to somebody else for something, that's an event that happens and now you have a relationship. And that algorithm is what we model and we put into the software. So discrete event simulation is just being able to model what's happening in the real world and the digital world. That is a very basic definition. It's also a very basic foundation. As you start to build on top of that, that's how you evolve from being into a simulation environment to a digital twin. A digital twin is an evolution of it. So what happens is that now that you have your representation of your real world, and now you have all the relationships of what's happening within that world, what will happen now is that digital world and that physical world were still separated. Right? You were able to look at your physical world and model it, but they're still 2 different instances of a situation, of an environment. What you do with digital twin is you start to have them talk to each other. So now you have your machines or your people or your sensors that are in the real world sending information to the digital world. The digital world is taking all this information and it's ingesting it, it's processing it, it's doing something to it. In our world, it's optimizing it. It's taking what's happening in that physical world, it's making it better. It's trying to see what's the best way to do something. What's the best way to put material out? What's the best way for 2 people to interact in the shortest amount of time so that you can get something done? Whether they're transferring material, whether they're working on a product, or, recent times, whether they're too close and there needs to be some social distancing that needs to happen. So we need to model all that so we can see what happens in that environment. The true digital twin is when that digital environment starts to tell the real world what to do, when it starts to send signals back. The physical world was used to create the digital world, but now the digital world has optimized what should be happening. So now it knows enough to tell the physical world what's better, what's the most optimal way of doing something. And that's a true digital twin. A true digital twin, it's bidirectional. It's where the 2 different worlds are talking to each other consistently. And now it's not one system, now it's 2 systems. It's actually a cyber-physical system because you have your physical and you have your digital, and they're talking to each other continuously. And as they do that, they're both getting better. Because as your digital world starts to tell your physical world what works, your physical world now is also learning from the system that works or that doesn't work. So here's actually a different kind of input. Here's a more optimal input into what can work better. And so now you have this closed loop system that's really being able to make the other better as time goes on. There's a lot of benefits to that. There's a lot of advantages to doing that. And so when you look at the importance of digital twin, you start to see different reasons why it's really important to have. And you'll start to see why digital twin becomes a really important aspect to overall digital transformation. We talk a lot about digital transformation as different things such as automation and robotics. We think about supply chain. We think about different types of technologies out there that digital transformation is comprised of. Digital twin starts to lay the groundwork for it. It starts to lay the foundation for digital transformation to actually occur. And that's why it's so important, because it starts to answer the questions that digital transformation will eventually answer. So that's why your foundation has to be very strong. And it starts to answer questions and look at things that are really important moving forward, such as what's happening in your environment. How often have you been into a factory? All of us here have been on some kind of a loud floor, loud factory, where you are hearing things, where you're seeing things, maybe you're smelling things, and you're saying, what would happen if I did that instead? What would happen if I moved that to there? Or what would happen if I was to change that design? What would happen if I was to change it from this to that? How would that change everything else? So every time you're asking what would happen if, the two words that we hear is what if. All you're doing is you're asking what if. And you're not being able to answer that question necessarily every single time. You can in some ways, but if you think about the amount of what ifs you really ask in a day, each of those what ifs has a combination of what ifs that come from that. In most cases, that what if list of questions that you have starts to multiply pretty quickly as you start going through it, right? So what happens? Every time you ask a what if question, let's say that creates 1 million different combinations of what if. Well, you're not going to go through all the 1 million combinations. You don't have the time, you don't have the people, and you don't have the investment to do that. So what do? You look at the top 3, maybe. And how many do you try? Maybe the top 2. Maybe you just try the first one. Because you don't have time to go through all of those 1 million. Well, when you go through those 1 million, if you come to us and you say, hey, we have 1 million ways we could do this, but we're not going to do that. We're just going to do the first 2. We get to ask you, the 1 million, how about we actually think of the first 1 trillion? And we take the first 1 trillion and we put that into the software. Because we can do that. We have the ability. The digital world has the capability to process the 1 trillion what-ifs that we can't do by paper. And then we make it a little bit more complicated for fun. So we take each of those 1 trillion and we take permutation of each of those trillion. And now you're seeing upwards of 10 trillion simulations for one what-if question that you wouldn't have been able to do if you were doing it on paper. So we take that, we use that experiment, we come up with an answer, and that answer is really important for us to look at because now, as we start to test the what-if, we want to ask you for more complexity. You've seen the shirts that keep it simple? We hate those shirts because we want to make it complex. We want to make it very, very, very complex. Why is it? The more complexity you have, the more variables you have. The more variables you have, the more constraints you have. The more constraints you have, the more possibilities there are to find the right answer. So for us, we want complex problems. We want a lot of complexity because the more complexity you have means the more complete problem you have found. So we take that very complex environment, we add 9 to 10 trillion observations, and we test them all in the environment. We find the best answer. We do everything in the software. We change it. We move the table from here to there. We move the operator from here to there. We move the material. We try out the different process. We see if it works. We test it again and again and again and again until we find the best answer. And then we've changed the entire physical environment in the digital environment. And now you can go to the physical world and actually do it. So the entire time that you're doing all these changes and optimizations, nothing is happening to your physical world. Your digital world is changing, your physical is not. And so now all of your optimizations that you've tried and tested and proven to be true, you just walk over and move them around once. So either you measure twice and cut once in the real world, or you measure 9 trillion times and cut once. But the 9 trillion will probably get you more combinations to be able to see what works and what doesn't. And that's why it's really important to use different types of technologies in that way. So if you look at digital twin, and you look at why it's important, we now look at why we use it, right? We look at how it's used. It's really important to look at where it applies. In a industry that it does not have regulation, there's a lot of use cases, there's a lot of applications for it, right? Things are moving fast. You have short design cycles, short product life cycles. You're moving very quickly. Things are changing a lot of the time, and it's a different way of working. It's a different way of thinking, right? But now you move into regulation, right? You move into applications that are more regulated. A good example is medical. How convenient. And you think about what happens in a regulated environment, specifically related to medical. What happens in a medical environment when you're trying to make a product be more mainstream, right? You're trying to launch a product. You're trying to do something with whatever it is you're trying to do with the product. And you're trying to launch it to the larger population. There's a number of steps that you work your way through. And digital transformation starts to become really important because you start to say, well, how can I make my process of designing all the way to shipping or receiving or to the end user easier? Well, if you look at digital transformation, that's why digital twin becomes really important, because that's what lays the foundation for all the other technologies to come into play, right? If you don't have a simulation, if you don't have a digital twin, what good are all the different sensors that you have if they're not being able to communicate to a digital world? And so you start to go back to your overall cycle, overall product life cycle, and you look at all the different applications, all the different places where digital twin can become really important and can add value. The first place is before you even do anything. The first place that digital twin becomes really important is before something even happens. And that's when you start to talk about your product. You start to talk about, what are the different ways you're going to do it, the product design, the use case, the markets, the whatever that is, right? And you're starting to think about what that will be, what that will do. Well, that will start to influence what happens as you start to plan to build that product, right? You're planning your end markets, you're planning your channels, you're planning your design, you're planning what's going to happen after the product is built. So now you're starting to think of locations, you're starting to think of where it will be built, you're starting to think of who will build it, you're just going to start to think of how it will be built. So you're not planning all these different things. You may not have a lot of information, but that's okay. Simulation doesn't mean that you have to have everything at once. It means that you will be forced to think of everything at some point. And so what happens is now when you're planning, you can start to say, well, all I know right now is that I want to serve a certain kind of market and a certain kind of geography and at a certain time. So now you can start to build out your model. You can start to think of what really will happen at a very large scale. And now you go one level deeper, which is how will I build it? How will I actually build that product? Now I know where I'm going to go with it. How am I going to actually build it? So you start to think of the building. When you start to think of the building, now you have to think of the process of what will happen when you build it. Will it require plastics? Will it require electronic components? The answer is probably yes to both. And so now you have to think about what are the different variables that's being comprised of, and you have to start modeling that. You have to start thinking of what that will look like. Well, because of the fact that we work in such an industry in which we have to be very careful, because we're not making anything. We're making something that's very important to someone's life. And so you don't really have the ability to just try it out. And that's where regulation comes into play. That's where quality comes into play. You can't just do something for the sake of doing it to see if it works. You have to actually plan for it and build for it properly. So you don't have to build for it physically. You can build for it in a simulated environment. Build it digitally. So now, as you start to build, you're building for what? You're building for a regulated industry to keep into account that you're going to be moving in a certain amount of space and time, and that you have to make sure that you have all the proper checks and balances in place to get there. So why do you have to do all the checks and balances physically? Why do you have to account for quality in a physical environment by just trying it out when you can start to do that in a in a digital environment. So now your digital world, your simulated world, is now telling you how to build something. Now you're going to go and actually start making it. Now you're going to put the machines into place. You're going to put the people there. You're going to have physical material. You're going to have physical things that will be making this physical product. So sometimes we jump, right? We've planned. We know what we're going to build. Now let's go directly into the shop floor. We will stop you. We will tell you, let's simulate that first, too. Let's actually simulate how you're going to make it. What you think might happen may not be what will actually happen. And that's where a lot of us in this room get really, really excited, because we start to make things and then we see a lot of quality things come about, right? So when we do that, instead of doing that, how about we do it in a digital twin? How about we make it there first? The regulation that the industry brings allows us to use that to our advantage. Because if we can simulate all of that first, we can use that in our conversations with all the regulatory bodies. This is how we're planning to build this product. This is our plan. This is how we're going to build it. This is how it's going to be made. We're not doing anything yet. We haven't broken any ground. We haven't bought any machine. We haven't hired anybody. We're just showing you what it will look like, what it can look like, what will be made by what we have. And that gets your conversation going. As you move into starting to build it, your lights turn on, machines start to hum, people start to walk in, you start to see the materials start flowing, you're actually starting to make product. You're now getting into a point where you've ramped up, you're now sustaining your operations. Well, your digital twin, if you think back to digital twin, it's a simulation, right? It's disconnected from your physical world. But this is why we start to think about it, about how we're going to make it a digital twin. We start to put the sensors and the automation and all the different things that we need to have to make that physical world and that digital world speak to each other and be bidirectional. Well, now we can take that, we can monitor it. We can now give that to our regulated industries and regulated bodies and say, here's what we're doing. Here's how it is. Here's how the world, how this product is being made. Here's how this world looks like. And that conversation with regulation becomes so much more direct, so much more transparent, so much easier to have, because you've been keeping them along throughout this entire process. If you think about it, what you're doing is not just creating a plan in a simulation software, you're actually creating, in the beginning, a birth certificate of your product. And as you move through the entire process, you're going through the product life cycle. That's why it's called the life cycle, right? So as you keep everyone through the life cycle, now your regulations start to become a collaboration. It starts to become something that's working with you. Your collaboration with regulations changes. You're not really reporting and being audited. You're more actually just solving the problem together. So your collaboration becomes much more powerful. Now there's more room for you to have those conversations. Now there's time. Now there's the ability for you to talk about it, which you really could have done before, but maybe not as effectively or as completely or as quickly. So you now have, from planning all the way to sustaining, covered through simulation and digital twin, and you're being able to use that to have the conversations with all of your stakeholders. Regulation just happens to be a really important one, but now think about how you can have that conversation with your ops teams, with your finance teams, with your fellow quality teams. So it just becomes, more than anything, it becomes a common language. It becomes a platform for you to have a discussion that you could maybe not have had as easy before you had the digital twin. Now I can sit here and talk about that for hours and hours and hours, but hey, if you ask me to talk about something that I love, that's a really bad idea, because then I just keep going. So instead of that, I'll tell you about how something actually works. I'll tell you about how an actual use case of technology can be seen. What you see on the screen here is a real example. It's a real example of a medical product. This is a highly regulated industry. We work very closely with all the regulatory bodies that you can imagine that are in this room as well. And we work really closely with the customer. We work really closely with all different organizations that are a part of this. It's always a team effort. You always have to have room at the table to work with all different people to get things done and be exceeding expectations. This example here is where we had a medical product and we had to meet a certain demand. Very, very relatable problem, right? You have a demand, you have to meet it. Well, in our culture, we like to exceed it. So we have to think about how are we going to not just meet it, but how are we going to exceed it? How are we going to exceed the expectations? You don't have anything yet. We don't have a floor. We don't have a factory. At that time, we didn't. Now we do. We didn't have a floor. We didn't have a factory. We didn't have people. We didn't have anything. So how are we going to make sure that we exceed it? Well, you call digital twin. And you start to create a digital twin of what happens when your material comes into the factory to when your finished goods leave the factory. So you start to model everything. The model is progressive. We use I and I. We iterate and we increment as time goes on. So in the beginning, we had very little information. We just knew what the product looked like. That was essentially all we had. And then we started to go deeper and deeper. As the product matured, as the relationship and collaboration with the different people and different organizations improved and increased, we started to get more information. We started to understand what the bill of materials was like, what the quality standards were, what was the cost of poor quality, of not being able to do something that they needed us to do. What was the time, what was the cost, what was all the variables that you think of in terms of manufacturing. So we created that model, as you can see here, and we started to map out what would happen if certain things happened. We put different what-if scenarios. We put a lot of different variables and constraints in there, and we started to run the model. And what we found was that we could not just exceed the volume, we could not just meet it, we could exceed it. And that was where the value really came from, which was how do you exceed what you've been given as a goal. What you see here is the metrics of how we were able to track and exceed what we were trying to accomplish. Now, if you look at the operational advantages of what you see here, it's a very advantageous tool to have. But the point here is that it's not one thing that gets you there. It's the combination and the summation of all the different collaboration that happens with all the different organizations behind these slides that makes it what it is. And that's why it's really important that you use technology as a fabric of communication, as a fabric of collaboration between different organizations to be able to do that. There's always going to be room to add more people. There's always going to be room to collaborate more. So if you do that, you start to exceed your expectations. And the expectations of you, of yourself, of your customer, of the regulated bodies that are there to help you. And that's why it's really important to look at that. So after we walk away today, there's a few things to keep in mind. A few things that, if I could say that you could think about after we're done here, is that it's really important that you partner not just with your colleagues. It's that you partner across the ecosystem. It's really important that you look at the partnership that you have with your customers, with your suppliers, with the regulatory bodies that you work with, specifically when it comes to medical. It's really important that you have those communication channels there and that collaboration there, because that partnership is what will be very important for us to adopt. That's what's going to make it so that it's adopting. The world is not changing. The world has changed. So what we have to do is we really have to make sure that we do what's necessary for us to be able to change with it. Healthcare specifically has changed drastically in the last decade, right? Now you see the word digital healthcare. You don't see anymore just healthcare. You don't see just health, you see health solutions. You don't see just healthcare without any other word added to it. You see healthcare technology. You see AI in healthcare. You start to see how healthcare has changed. And that's why when it changes in front of the world, it has to change how we do it too. And that's why when you look at the ecosystem, when you look at all the different players and all the different components that make up that ecosystem, it's more important for us now, more than ever, for us to partner across that ecosystem in our own different way, whether that be through regulation, whether that be through the supplier, the supply chain, the manufacturing, the design, whatever that might be. It's really important for us to partner on that and have that ecosystem maintain that. And that's why it's really important that you have to find the partner that really works, because you have to have that collaboration. You have to have that open level of communication and transparency where you can have those conversations and make sure that you have room on the table for everyone to voice their opinions and contribute to the overall success of it. If you walk into a situation and you don't really know what you're trying to solve, that's going to be an issue, right? So if you think about it from a strategy level, a very, very high level discussion, we're talking about ecosystem partnership. But what happens when you have your table? You have room at your table for all these different people to join in and succeed together. But what happens if you don't really know what you're trying to succeed at? So it's really important that you sit down at that table and that you know what you're really trying to solve. You know what your problem statement is. You know what your scope is. You know what it is that you're trying to exceed. And that's why when you start to do that, you get into these types of situations where you can start to understand what's the information that you need, where do you need it, how do you need it, how often do you need it, where do you need it to come from, what's the different technology pillars that you need to incorporate, the different organizations that you have to partner with. It becomes really important that you understand what are the different things that are needed so that you can get to that point of exceeding whatever you're trying to exceed. I always end with a very important note that is a question that we get asked very, very, very often. This is a question that people always ask us, and that's why I always make sure to cover that as the most important in the last part of the presentation, which is people ask, how do you get the technology, how do you get the software, how do you get these things going? And it's really easy to do it. So it's not a very hard problem to solve. You actually just go out there, you just buy the software, and you install it. That's all you really have to do to be successful. And so people kind of look at you a little bit funny and say, that doesn't make any sense, right? It's really not that easy. Well, it is if you just want to buy the software and install it. The value doesn't come from the machine that has the software. It comes from the person that's on the other side of the screen that's using the software. It comes from the person that you're actually designing your product for. And it comes from the people that are going to be on that line every single day that are going to be building that product for you. So when you start to think of digital transformation, when you start to think of digital twin, you start to think of collaboration, and you start to think about how there's room for everybody to collaborate, you have to also think about the fact that all the things that we're thinking about in this is the people. It's the people that you're helping, it's the people that you're collaborating with, it's the people that you're working with that are going to get something done. When we say that there's room for all of us to work together, you're talking about the people that are going to come together. You have room for people to come together and collaborate and get something done. So as you start to develop, as you define and you develop and you deploy your technology, the most important variable across all of those things is the people that you're going to be working with, that you're going to be working for, and that are going to be working for you and with you. Because if you have a technology and it's amazing and it's fantastic and it's so advanced, but it doesn't give your consumer the value, it has no value. If it doesn't give your operator an easier day, it doesn't make it easier for them to do what they're trying to do, you don't have any value. If it doesn't make it easy to understand or collaborate with a regulatory body, if someone shows up in medical and they have no idea what you're trying to do and it doesn't make any sense to them, you're not going to get very far in launching your product anyway. So as you start to think of all the different technology blocks and technology components and all the different things that are out there that make you able to exceed your expectations, you're exceeding the expectations of people. And that's why you have to be able to think of the people throughout the entire process of getting something done. So they are the most important as you start to embark on a journey for any kind of transformation, whether it's digital or anything else. But always keep in mind that you're working for the people so that you can make it easier for them and how you're working with them. So as we end on this, as we move forward and as we wrap up, I'll just tell you guys that, as I go to work every single day and I see that seal that says room for all, I hope that you guys also think about how there is room for everyone at the table. Because as we start to collaborate across the industry, it's going to become very important that we work on it together to achieve all these different things. So with that, I'll say thank you very much to everyone here, and it was my honor and privilege. Thanks so much, Paul. Thank you.
It was really good.
Thank you. Thank you. I appreciate it.
People part.
That's
So if we can have the panelists come forward, please.
What's your question going to be?
Is that a new look?
So, after Square, I have to at least look smarter.
do it. Or,
You sit somewhere in the middle,
oh, it's okay.
and Jason will sit next to you.
Okay.
So, yeah. Anywhere.
Oh, yeah, where's Jason?
He's coming.
There he is.
Okay, get him to. I may call on you just so you know.
All right, you can go ahead and kick it off. Say hi to Rob.
Are you gonna?
All right, that was, what a way to get inspired for day 2. Thank you, Zohair. That was just, the people part, I actually have tears in my eyes. That was pretty emotional, I would say, because it's a true point, right? Peoples are humans, right? And we really have to give them the benefit of actually the successes don't come from machines. And I don't know about you, but I've seen it so many times in our industry where companies buy software and they expect it to do magic for them. They design their quality processes around the software, right? Which probably is the wrong approach, but it is the people element. Why don't you follow the quality procedures? Well, because they're 150 pages. We bought them off the shelf. Well, you do realize you're making a device and not a pharmaceutical. Oh, is there a difference? Well, anyway. So I want to introduce the panel. Jason is going to moderate this nice panel of Cisco, Joe, and Zohair, and Jason, and I'll let you kick it away.
Yes, sure. Can everybody hear me? No.
Not yet.
How about now? No. Good? Yeah, everybody hear me now? Yes. Excellent. All right. Hello, everybody. I'm pinch hitting for Prakash. Couldn't make it. Again, my name's Jason Spiegler. I'm the Senior Vice President of Strategy at Compliance Group. Prior to that, 16 plus years with Siemens Digital Industries, and came out of medical devices and quality management with J&J and a few startups. So, yeah, so maybe to kick this off, so I think everybody's met the panel yesterday, but first want to thank Zohair. Great job. Appreciate you setting the foundation for, I think, what's going to be a great panel discussion. I want to make a few comments before we dive into this. Oh, no.
Yeah.
That's not good. All right. Let me make you guys can still hear me, right? All right, good. So a few comments. I have a confession to make. I am very biased. I think this is the coolest program in MDIC. This is actually going to make Kappa cooler. So, you know, what I thought of when I saw your presentation, right? Has anyone seen Iron Man? Right? Everybody, right? Come on, the Avengers, right? That's what we're talking about here, right? We're talking about taking Tony Stark and Iron Man to the medical device industry. And the crazy thing is, as you heard, these technologies have been around for a long time. This isn't new. They've been used in all these other industries, right? So why not with us? On a personal level, I'm so excited to see where the program is now. We'll get into the journey of the program in a few minutes, but I've been working first with Siemens and Compliance Group for the last 12 years, collaborating with Cisco and many of his colleagues at FDA, more than anything to help educate, allow them to explore and experiment with many of these digital twin and digital thread technologies, and I'm sure we'll get into that a little bit as we go through. So there's a tremendous amount of opportunity for all of you, all the manufacturers. At the end of this session, where's Steve? Steve, why don't you introduce yourself real quick?
I'm Steve Zara. I'm co-leading the Advanced Manufacturing Clearinghouse program at MDIC, and again, happy to have Zohair here. I want to also make sure that if anybody has any questions, please come on up before we get into the panelists, and if you have any questions specifically for Zohair. Thank
Yeah, great. So at the end of the session, the breaks, I want a line for Steve of everybody wanting to get involved and understand how to participate, right? And not just the manufacturers, but all the consulting companies. You ought to be telling your customers about this. I think there's a tremendous amount of value that this program is going to bring, and we'll get into that in a few minutes. As I said, it's been a long time coming. I know Alan Baumel, Joe, Steve, Prakash, I mean, you guys have been working on this for 2+ years, so kudos, and of course the Cisco and the FDA. So yeah, so very excited about that. So panel flow, I'm going to build off of Zohair's presentation with a few questions. Then we'll transition into the clearinghouse. We're going to have some miscellaneous questions. Certainly want to take questions from the audience. May have a few audience members contribute to some of the questions as well. So why don't we dive in? So Cisco, first question for you. Certainly feel free, other panelists, to dive in. So I think of the VIP program, Cisco.
Yep.
From a regulatory oversight perspective, what I think was phenomenal was being able to identify ways to streamline activities within the agency and create value, which then translated into value for the manufacturers. Quote unquote incentives, right? When you look at the digital twin, the manufacturing digital twin examples you saw from Zohair, and what you've seen from some of the programs we've done over the last few years, what are some of those areas to streamline within the agency and create incentives for the manufacturers?
That's actually a great question, because I think there's so much opportunity. You know, even as Zohair mentioned here, right, when you're talking about what the capability is able to do and you're engaged, you're looking at things from that digital twin standpoint. And, you know, we kind of had an opportunity to go through that experience at FDA, right? When COVID hit, you know, we were looking for ways and solutions to the immediate crisis, but how do we prevent this in the future? And, you know, credit to Medtronic, who at that point in time released their public files on a ventilator when we were having a shortage. You know, we kind of leveraged that information because it's information we never typically get even through an inspection, and worked with Siemens to build out the full digital twin around the ventilator. And that gave us a lot of insight of what this could potentially do, right? This is about, and to the point you're mentioning, right, where does it become an incentive? But the reality of the matter is it could drastically change the approach that we do from an oversight standpoint. Everything from our interactions throughout the whole life cycle, right? How do we assess our organization? How can we, you know, evaluate the products in a better fashion? How do we gain efficiencies in that? And how do we focus on the right things? Better monitoring in the real world, better understanding of the product when it comes in because of the trillion iterations that you can go through, right? It's just a better design phase. We saw opportunities live demonstrated in the simulations to optimize production and gain big increases just by moving around layout production flow. So, you know, the potential that it has for what we can do in concert as an agency to help either support or better use the output, the data, the information that comes from that, it's huge. It's just, there isn't really a limit at this point in time to what we can do, but it does take not necessarily a rewrite of the regs, because again, they're very flexible. It takes some understanding of what this is offering us that meets that intent. And how do we really leverage that from an agency standpoint to meet our regulatory obligation? But at the same time, you know, it should be, again, about helping the end goal is the patient. Manufacturers will get the benefit along the way. So it's, I'm always baffled with the opportunities that this enables and drives. And we were talking a little bit earlier at the table about how even the idea of digitalization in this space helps drive the culture, right? You kind of permeate or create that error-proofing within the production processes. It's a big opportunity, I think, for everyone here to really move forward with. Incidentally, a lot of the work that we did with the digital twin Hopefully, we'll be going live somewhere in the fall in the FDA's innovation lab, right? They took that work and they went a lot further with it and demonstrated what you could do through a lot of different simulation scenarios. In partnership with Siemens at that point in time, they've got this being built out, and that will help be an education resource for us as an agency, but also for, again, industry participants, academia, right? How do we get more of that involvement to help collectively build out the community and get them educated on the potential of these technologies?
Yep. Great. Anything you want to add, Joe?
No, I'll wait.
Okay, wait. So I'll just add to what you said. So I wasn't joking about making Kappa cooler. All right. So how many of you all do effectiveness, right, for Kappa? How many of you can knock out effectiveness in a few days? Doesn't it normally take weeks or longer to do the effectiveness piece of a Kappa? Well, imagine if you could run trillions of what-if scenarios, okay, around the Kappa that you're trying to implement. Imagine being able to close the effectiveness piece significantly faster. Cisco, would that be an opportunity?
Again, within the realm of what's possible and doable, right?
All right.
Process validation.
I was going to poke at that next. So process validation.
Risk.
Risk. Let's simulate the risk. Absolutely. Design transfer. Absolutely. So many opportunities here to really streamline, error-proof, get that visibility, right, through the use of digital twins and digital threads. I'll just add with this, the innovation lab that Cisco mentioned at FDA as part of OSET, which I didn't even know there was an OSET, right, the Office of Counterterrorism and Emerging Threats until the pandemic. But, I mean, this will be hopefully fall, will be live, end-to-end digital thread, digital twin use cases involving almost every technology you can think of, right? MES, PLM, QMS, all kinds of modeling, ALM, modeling, simulate, every acronym, right? Modeling, simulation, and product development through manufacture, design, transfer, risk management. Again, a fantastic opportunity for the FDA to really explore and experiment, right, on what these technologies can really do to drive value for the patients, providers, and for the industry, right? So again, I think there's a lot of opportunity with this program. Go ahead, Joe.
I'll speak. What you just heard described is not advanced manufacturing. It is the digitalization of your total product life cycle. And that's really the emphasis that we want to play. And we talked about this a couple of years ago. It's like, boy, if we had an opportunity to change the name of this program, we probably would have, because of all of the things that you guys just heard. You know, it's not just about the manufacturing on the floor. It's risk management. It's design quality. It's, you know, post-market surveillance. It's all of those things that are part of your total product life cycle. And as you operationalize a digital transformation, Rob, how did I say that? Okay, operationalization. Is that okay? But it's that universe, right? So when you think about advanced manufacturing and what we're trying to do here, it's not limited to just the manufacturing piece or the design piece. It's all of those interactions, all of the people involved in getting product from ideation to commercialization, and that's everything in between.
Yeah, I was going to bring that up later, but
Sorry.
there's no, thank you. No, perfect. There's several myths, I think, around this program. One of those is a misnomer that it's advanced manufacturing and it's only manufacturing use cases. That is not the case, right? It's total product life cycle. We'll get into hopefully some more examples of some potential projects in the clearinghouse in a few minutes. So any other use cases the panel wants to bring up that you think will create value for both the agency or the manufacturers?
I mean, like I said, I could sit here and rattle off all the potential use cases, but then, you know, we always get held to, well, when are we going to do that? We're still starting, right?
Yeah.
So let's just get everybody rolling and moving in direction of starting to implement and apply some of this capability and technologies.
I think the simulation lab
Yeah.
is a huge advantage, because we talked about it a little bit yesterday, even at the opening, about how all the work that we're creating, whether it's in digital transformation or it's case for quality or CAPA, will, or submission quality, will eventually be on the shoulders of the agency at the reviewer level or at the OHT level. And having that awareness of what's coming creates that connection. And you talked about how to have those conversations early and often. And we heard it all the time that agency wants you to have those conversations. And so it's really important to be able to have those conversations early and often, but it's also really important for FDA to have a baseline of, well, what is it you're actually talking about? And that simulation lab, I think, is going to be a huge advantage to educating internally so that they know what's coming next, or what's it's not even on the horizon, it's on its way, right? It's coming.
So I know there's a couple questions, audience and online. We'll get to them in a few minutes. I want to ask 2 more questions to the panel to tee things up a little bit more. So, we talked about some exciting use cases that could create a lot of value. Okay, why hasn't the industry generally applied this yet, right? Why are we not using these technologies in medical devices and diagnostics? Where I'm going with the question is, what are the barriers? What are the sources of friction that have been holding back the industry? And let me open it up. Maybe we'll just start with Zohair, and then whoever wants to chime in, and then we'll open up to the audience, because I want to hear your thoughts too.
Yeah, I'll do one, and then pass it on. Of course, there's quite a few, unfortunately, but one that I'll say is just data integrity and data availability, and I would say existing system architecture, right? Which is that, unfortunately, I think everyone suffers from this. It's not one person or company specifically, but it's, if you look at how to introduce digital transformation, one of the largest challenges that we face is that you are trying to migrate a manual process to an automated process, right? And it's just, things are done differently when things are manual, right? We were talking about that earlier this morning. And when you start to digitize things, you start to see that there is an absence of data. There might be an absence of accurate data or clear data or validated data. And so then you have to almost stop your digital transformation in a way and go back to the basics. And then you have to figure out your processes and where the data is and how it is and why it's a certain way. And then, are we collecting that information? Are we not collecting it? Sometimes we collect a lot of information that we don't even need. And then sometimes we collect nothing for the most important things. And so we end up going down this path of digital transformation, but then not really being ready for it. And then so we see all these use cases, these applications, and we say, oh yeah, let's do that. That sounds very, very profitable, very good, very, very advantageous. And then you start to do it and you see you don't even have the basics for it. You don't have the foundation set up for it. So then you stop. You start and you stop, and you start and you stop, you start and stop again and again, because as you keep starting up, you see, oh, well, we don't have that either. Oh, we have too much of that. Or we need to clean that up, and we need to process this, or whatever it is. And so I think that that's a major challenge, and I think, unfortunately, it requires us to sometimes stop being advanced and being really basic, and seeing that's necessary, and then building up from there, which is, I mean, I know it's easier said than done, and I know it's not exactly the most attractive thing to pursue, but it's necessary when you start to try to actually do it, right?
That's a great point.
For your test runs and build out things. So that seems to be a problem with everybody. Nobody has enough data. Nobody has enough data to build out or to play with it.
Yeah, so just for those online, the question is, how do we get more test data, right, in order to be able to run these trillion what-if scenarios?
Yeah, there's a number of different ways. So the first thing that I would say is that, and I'm assuming you're talking about in more of the design phase, right? So when you are designing the product, when you're going into the different assemblies of it, right? One of the ways that you can approach it is that you don't use the actual product. So there's a 3F method, which is form, fit, and function, which is that you basically just you make it some other way. A popular way is to 3D print it, right? Which is, you 3D print the product, you test it, et cetera, and then you go back and you keep and you keep doing it on the real product. So you can do that as a form, fit, and function way, which is you print it somewhere else, you test it, generate the data. One other way that we've seen it is that you can start to incorporate things like sensors, right? And you have to be very careful with that because you can't just take every product, put a bunch of sensors on it, do destructive testing, and then go build it again because now you're incurring a lot of cost. So what you want to do is you want to be very careful on what is critical to quality of how you can measure what you need to measure, and then go into the testing of it. Now, one thing I'll refer to from the presentation is we know that you're not going to be able to have a lot of data in the design phase. And that's important because it doesn't mean that you'll have everything then, so you will have to incrementally add it. So you have to be careful on what information and what data you want from that stage that can be used to influence the decisions in the following stages. Because it's unrealistic for us to assume that we're going to be able to capture every single important data point from the beginning. You know, there's going to be some that we can get and some that are impossible to get until you move forward. And that's how you kind of balance it and see what are the things that I need now versus what will I get later.
It's a great question, and I heard it a lot when I was at Siemens, right? This is awesome. This is so cool. How do I get the data, right? And we can talk offline. There's a lot of creative ways to do it, but I'm just going to add one word to data integrity. I'll call it digital data integrity, right? So that's any other frictions or sources of friction or barriers?
Well, what I just heard was a real opportunity for a use case. Because, you know, we've routinely asked ourselves, why does the med device industry lag in this area? And I think one of the things that I just heard was, you know, we've made this assumption that people are going to make this investment and we're going to be able to get these use cases to demonstrate how they overcame certain obstacles. But if you can't overcome the obstacle of convincing people that I need to generate data and I may start and I may stop, now you're up against some of the things we heard from Loretta yesterday, which was that C-suite wants instant results. They want the return on investment. And there needs to be a balance between what you want to do and what you really need to do to get there, right? So you can visualize the outcome, but the journey isn't going to be as easy as, you know, that horizon looks a lot closer than it really is, right? So I think that what we should be able to do as part of the clearinghouse is not only talk about the journey that that industry is on in implementing a particular digital transformation, but how do you overcome some of those very basic challenges of proof of concept? Because, again, I think we've all experienced this. If you don't have a proper ROI, or if you can't have that ROI conversation up front, it's going to be really hard to make that initial investment. So I'd like to
We'll talk.
volunteer time to talk about that, because I think, you know, we at MDIC, I mean, when you think about the value of the Advanced Manufacturing Clearinghouse, it's a model that MDIC has been following for many, many years. And I think Carolyn from our health provider, I apologize, I don't remember her last name, but she talked about storytelling. And that's the value of what MDIC is able to do, is bring people together to tell their stories and share their stories, the successful practices, the overcoming challenges. And this is exactly what the clearinghouse is designed to do. But imagine the value of being able to give something to someone that says, how do we even get started?
Yeah.
Right? What barriers do I have to take with me to the C-suite to say, in my current world, I'm able to do this. In my future state, I'll be able to do this, but there's a gap here getting there. So I need patience, I need investment, I need confidence that you're going to, you know, be there with me to do this. It's just like culture. You need C-suite engagement, C-suite support on driving quality culture. You're going to need this to drive this digital transformation. So I'm really glad you mentioned that, because we have been trying to make sure that whatever we do brings value, has an expected impact. And we believe intuitively that this digital transformation will have a lot of benefit, not just from an education perspective, of making people more aware of what digital transformation is all about, but how to get there and how to overcome those barriers. So I'm glad you mentioned that.
Well, I don't know if you want to add anything, Cisco.
So I saw, in addition to the storytelling, because I think there's something that needs to be really conveyed with that notion, right? We need some of these positive stories going out there. Here is what we encountered. Here are the things. Here's how we iterated to go back and clean up our data, but it still ended up with a successful endpoint. Because part, I think, of the barriers that exist out there are the negative stories, right? At least as I've been finding, a lot of urban myth that's been built up around these things that we need to figure out a way to counter, right? One of the things that early on in our journey, and Jason's very familiar because he helped coordinate it, was learning from the industry itself. We went out there to say, hey, this makes sense. Let's just get data from companies. And companies said, yeah, we'd love to get data too. It's not something that they were investing their capabilities in. Right? They weren't investing in the technologies. Went through to find out what it was that was driving that. Going back to, you find little things and you think you're moving this path, you got to stop and address that.
Basics.
Validation, right? Something that was perceived as a regulatory barrier that we never thought was a regulatory barrier until we had that feedback point. So again, the engagement and the collaboration, industry wasn't investing in the capabilities because on top of the ROI discussion, they added this extra cost of this extensive, overly burdensome validation process that was never in our policy.
Self-inflicted.
Right, exactly. But it turned into this urban myth of what FDA wanted and expected, so we had to work back and reset that, similar to like we did with Kappa recently, right? The difference being with Kappa, the team moved very quickly, agilely, and said, we could just fix this ourselves. We created this. We could fix this. With CSV, the industry asked for guidance, and so that policy development took a longer process. But clearing those types of barriers, whether they are real or perceived, is part of, I think, what we'd like to do and get through it as part of the clearinghouse.
Yeah, I think that's a great opportunity to talk about the CSA, the computer software assurance.
Yeah, let's
and the
come
value
back.
that brings.
Let's
to this process.
let's come back to the CSA because so I want to make sure we hit on CSA validation, program management, organizational adoption. Right, these are the big challenges I think when we're looking at digital transformation. Right, and I also want to go to you guys, but before I do that, one last question because I really wanted to tee this up, right? So we're talking about these barriers, these sources of friction. Wouldn't it be great if there was a program that brought the industry and the agency together to go after this? And collaboration, right? Room at the table for everybody. Joe, why don't you tell us a little bit about the clearinghouse? What's the why, the value, the journey?
So I talked a little bit about it already, but when we thought about the digital transformation, we started talking with FDA about advanced manufacturing, and you mentioned some of the early folks with Alan Baumel and the work that he did with Cisco and Jason before I even became a member of MDAC. We had these conversations about what is advanced manufacturing clearinghouse. And again, it really, the value of the clearinghouse is to be able to create that portal where you're able to share your experiences, both positive and negative. Share that journey so that more folks will be drawn to the process and to make those investments and to make to get in that journey and the value of that. And so when you think about what we're doing, we're driving that collaboration with the agency. We're giving you an opportunity through the program to sit with FDA to talk about what it is you want to do, and then in return, we would like to have you share your experiences. And it's about your journey. It has nothing to do with your technology or the product that you're making or the IP. That comes up quite a bit in terms of, well, what kind of information are you really looking for? And it's really more about the storytelling. And in return, what we've set up with support from the agency and funding, we'll subsidize the program. So you're able to. And you'll hear about this on Monday afternoon. We're actually doing a webinar on the process of how to apply, what does the process look like, what do we do with the process, how do we go through review and determination, scoring and selection. But in return, what we'll do is we'll provide funding up to 30% of your total cost to a maximum of $300,000. And for some organizations, that's significant. And when we talk about the theme of this meeting this week, it's really to engage with some of these smaller companies, because we strongly believe that those small companies would benefit, one, from the subsidizing the cost, as well as having the flexibility and be agile enough to make these initial investments, where maybe a multinational might have a different set of barriers to overcome. So we really want to hear more from those smaller companies to really get some of these programs up and running. But it's the value of the clearinghouse is to be able to share those stories, and the value of getting involved is that in return for your information, there's an incentive to help offset some of the cost of your programs.
Yeah, awesome.
A piece of that is also that the agency has committed to being involved in part of the process, right? It helps us learn what is truly urban myth we need to clarify versus is there really a policy need that needs to be developed there?
Yeah.
And this is a couple. I mean, this is not a one and done, right?
Yeah.
We've just started this. We've been working on this. We have funding for this program. We expect to see, in the first year alone, we're targeting 5 programs to get this thing started. But through Cisco's guidance and his vision, it's what could the future look like? Could it be 10? Could it be 15? Could it be 20 programs? And I think that's what we're looking at. So you can talk about this as being a pilot program, but I think ultimately it's the lessons we're going to learn to be able to influence guidance, to influence policy, to influence transformation.
I'll just add, if you want to see an example of an output from this program, how many of you have seen the W.L. Gore MDIC paper that was written? All right, just a few. So maybe as a follow-up, that could be.
It's
sent
available.
out,
It's
right?
available on our site, and you can check with Steve to get access to it as well. But that was actually done without any funding, without any subsidy. They were
Don't
on
need
this journey,
funding
right?
to participate.
Right. But again, in return for sharing your examples, that's our commitment to you. But that W.L. Gore paper really talks all about the things that essentially checks all the boxes of what the purpose of the portal is, with the addition of this new use case that we need to work on.
Okay, so I apologize for anyone online. We've got a lot of people that have been standing for a while with questions. I just wanted to make sure we teed up what is the clearinghouse. But go ahead, George.
Yeah, and I think, Joe, maybe you kind of hit on this. And Jason, I appreciate your Iron Man analogy, because Iron Man was Tony Stark, who I think was like the richest man in the world, right? And I guess what I'm seeing as a barrier here, and maybe the clearinghouse is hitting on it a bit, Joe, is I'm thinking of like the small manufacturer, right? Which I think we heard yesterday, 80% of them, the manufacturers out there, are companies that are 50 people or less. IVD manufacturer, they may barely have enough money to invest in a quality system,
Right.
not just in an EQMS, but like they're thinking of just getting product to market, and process validation is like this expensive thing. Kappa effectiveness is this expensive thing. And so then to come at them and say, hey, how can we get trillions of data points for you, seems to be, it's an Iron Man suit. It's like, I'm driving my Honda Accord to work instead. So I'm wondering, how do we, and I don't quite have all the clearinghouse piece put together as to how that's going to fit. What is the ROI selling point or the elevator speech to that small company to get them to invest into something like this? Because otherwise, I think it sounds super cool, but it seems like it's a generation away for the small manufacturer. Thank you.
Thanks, George. So from building the infrastructure for the clearinghouse, we had a lot of conversations about the incentives and getting small manufacturers that are in that scenario. We haven't quite solved it, but we have talked about the possibility of providing even more than the 30%, because if the cost of their project is minimal but it's significant to them, then a small investment may not be enough. But are there ways that we can create some flexibilities within the program that will draw in some of those folks that are making that decision, right? Because they have a fixed amount of money, they have to make decisions about where they're going to make those investments, and so we're open to working with them on a case-by-case basis. But we haven't quite figured that out, but that's on the table. That's been in conversation. Well, like I said, the pearl from today for me is this conversation about use case discussions even before you even start your digital transformation. What are your current barriers in your current program that is the current state of manufacturing or current state of operations, and how do you pull that information out to justify the investment of going forward? So that, I think that's because I really do think that there's an opportunity there to help answer some of those questions.
And I also think that there's an opportunity for different solutions to the problem, but understanding what the foundational problem is first, right? We hear that a lot about the small companies and what they can invest. The reality of the matter is, especially in small pockets just starting, right? Nothing says you've got to be, the full suite, having the Iron Man 3D thing coming up in front of you. That's not where you need to be. When we talk about advanced manufacturing, it's entirely throughout the life cycle. And any element that gets improved in that space frees up capacity, frees up information that then allows or enables the next improvement. It's about right-sizing where they can get started and letting them know that this is sufficient. Oftentimes, we hear about the potential or the cost of these systems, but they are actually, in a lot of cases, there's solutions out there that are right-sized for a small manufacturer. There's a way to offer that or get down to that level. A lot of companies are there to help even start the growth process with them. There's other networks, I don't know if our NIST partners are here, right, that they actually have resources and mechanisms to help small manufacturers in these spaces, right? It's connecting them with these additional resources that they can leverage as they move forward, but understanding that we want to tackle the right problem. Is it really that piece? Is it a technology barrier? Or, and I'm sure it's probably more likely, the people barrier. Do they have the skill set or expertise in-house? And that's a different solution.
Yeah. I'll just add, both sources of friction. One is getting at the data. We talked about that. Happy to talk offline with anybody after. I think there's a lot of inexpensive, creative, and fast ways to do that now. Secondly, I think education maybe is another friction or barrier, lack of education of these technologies, because to Cisco's point, I think there's some misperceptions on the cost of these solutions. You don't need to be as rich as Tony Stark to do this, right? So to your point about right sizing. Steve.
Let's start by adjusting the microphone. I'm not going to really focus my comments on the fact that MDIC excludes people who are kid-sized, but
You and me both, Steve.
you can yeah, exactly. You can draw your own conclusions. We'll caucus afterwards.
Yes.
We're working on it. We have a program for that.
It's going to be the next device and the next working group.
Make us taller.
So in any event, look. So my question is actually focused more for Cisco. This is a great project, and actually my question builds off of the points that you made, Joe, which is to say, with all of the device makers, the entire ecosystem, many of whom are really just focused on figuring out a way to get their devices to market and make money, right? How do you bring them into this effort in a way that demonstrates value? And so my question is to kind of frame the same topic for Cisco from a regulatory perspective. You may not be there yet, but what thinking is there about what FDA is doing to incentivize manufacturers to engage in these digital activities? So, and really at a very basic level, right? Whether you're looking at it from a pre-market side of getting devices to market or post-market of just managing the many regulatory requirements that companies face once they're on the market, right? Where's FDA in this, and is there a value proposition in terms of like satisfying basic regulatory requirements?
Yeah, so definitely in terms of just even satisfying basic regulatory requirements, there's a value proposition. And is there a way to leverage some type of technology for a small startup that, again, cost effective, right scale for them? There's ways to get that done, right? There's tools out there. It's how do we connect them to that piece, and how do we get the message out so that we can get them to engage, so we understand, again, where is it that they're really struggling, so that we can then target our efforts on our side, right? Again, is it really a policy issue? Do we need more education? Is it an opportunity to get the message out more? We don't really know which of these solutions is the right one for that audience yet. And that's part of what we're looking to learn through the clearinghouse.
Thank you.
Hello. So my question goes back to something that was briefly mentioned is on the IP side. So this is a digital twin. So what happens to protect the original IP side of this?
From a sharing of information piece?
Yes.
So we have our master services agreement and CDAs that would be in place to make sure that there's a clear understanding of what information is we're looking for. Now, under the CDA, during the process, you might be presenting to a group of folks that are under that same CDA, and there may be some technology questions. And so some of the early adopters that have already presented to us will get into that a little bit. But that's not our intention. And so when we talk about actually approving the project, the master agreement will talk more about the sharing of your journey and not about the IP. So like I said, we don't necessarily need to know your technology. I was talking to folks from Edwards yesterday about, we're not interested in, the impact of changing a radius or changing a dimension or changing a major component. It's really about collecting information about how you got there to be able to convince the infrastructure, the enterprise to make that investment in digital transformation.
A lot of these technologies are broken out into like broad categories, really. That's really what the focus is. How did you apply this type of technology to advance your business process or your activities? We don't get into the weeds of the actual product itself or what's going on. The technology use and applications, not really IP, right? There's a lot of stuff out there. If you applied it uniquely to your process in a very specific way, okay, that might be IP, but we still can get a starting point and an end result, and that's what we're interested in.
Yeah, I mean, for example, you make a change through your learning, through those trillion scenarios. You figured out a way to enhance your design and to enhance your product to eliminate, NCs or potentially even adverse events. You saw a % reduction in activity, in these events, and that's all you need to really talk about. You don't have to get into the details, like you said. You're not getting into the weeds of, well, we had this complication and we eliminated that complication. It's just a matter of reduction overall and a positive impact in enhancing the product quality and patient safety.
Yep. Great question, though.
Yeah,
Thank you.
it comes up quite a bit.
It does, yeah. Maybe we can jump back to one of the prior topics with CSA, and then we can come back to that. So let me put this question out to you guys. So again, validation is a misperception, right? What's required, right? That's where the FDA industry CSA team was started 7 years ago to work with the FDA to go after clarifying these misperceptions and streamlining validation. Do you want to talk a little bit more about what CSA is and how does it fit within the clearinghouse and digital transformation?
Yeah, I think the goal or idea of CSA was really to reiterate and clarify the, again, already existing policy that you can use risk-based approaches for a lot of these activities. We want you to use risk-based approaches. We had some discussions yesterday, and it's written in the preamble, right? Things should be commensurate in that space with the risk. CSA was focused, and the point of the guidance was to demonstrate, again, a way, not the way, not the, not a regulatory requirement that we're going to hold you to, a way to look at your validation activities from a risk-based perspective and tell that story, right? Because that's the piece that people always get hung up on is what's the investigator going to say or what's the auditor going to say. Any auditor, any investigator understands risk. And if you can convey them that you're in control of that risk, they are happy. So that's really what it's all about. And the guidance was getting everybody back to the notion of you can use risk. Here's what it might look like, but here's how you convey the story. And stop all this redundancy. Stop all this unnecessary burden and work and documentation generation because you think that's what an auditor wants to see. I can guarantee you, and we've had some of our investigators present with us, and they will tell you they don't want to see that at all. So it's bringing things back to an effective way to do your effort and your validation. And I think, in the W.L. Gore example, they didn't they weren't looking for additional funding. They were driving to that point. All they wanted was some engagement from the agency because they were leveraging some of the principles around CSA and clarity around what it would take from a submission standpoint. And once we got past that, they accelerated things on their end significantly.
So I'll just add on CSA. I mean, this is foundational for digital transformation. If you want the speed and the velocity, right, of rolling out these systems, being able to respond both externally to your customer base and your competitors, and be able to respond internally to the employee experience, you need to be taking a streamlined risk-based approach, leveraging unscripted testing, not redoing what your software vendor's already done if you trust them, right, if you qualified them. I mean, how do I say this nicely? But if you're not implementing CSA right now, you're at a competitive disadvantage and you're behind because your competitors are all starting to do this right now. So if anybody has any questions on CSA, there's several of us here. There's others in the room that are experts that have also been implementing this. Happy to chat with anybody about that. But
Yeah, I
it's
just
really
want to make
critical.
one comment about that, right? So when I first was introduced to CSA, I was in the industry and Jason brought it to my attention and I was like, this is a no-brainer. But there was a barrier and it was the leaders of the compliance organization were not convinced. But yet the folks that were asked to execute the CSA were all online and they were all bought in. And that usually is the reverse, right? So how many people either in this room or on the phone have heard yesterday the value of a risk-based approach to CAPA and are signing up to implement the risk-based approach to CAPA? CSA predates the risk-based approach to CAPA. So it's proven. And if anything, the CAPA improvement program has validated the approach that CSA was on 6-7 years ago. So I agree with Jason. Get involved, start implementing it because you will be behind. There's no disadvantage at this point to implementing it. There's only upside.
Great. We've got another question from the audience.
Yes, thank you. This goes back to the where's the data question and wondered if there's an opportunity for real-world evidence to play a part in filling in the gaps. I had a recent experience with a daughter who got married and I needed to provide a speech, so I went to ChatGPT and I got 5 pages of very eloquent, some of it was actually very relevant, but a lot of it wasn't. But
The value
perhaps
of
there's an
AI.
opportunity with the scenarios and the modeling to leverage previous experience from other companies to fill in the gaps where the sensors or the actual hard data is not available. Can you comment on that?
Yes.
Yes.
I mean,
Right,
And
that's
how
what
does
you're
that get
talking
done?
Yeah.
I mean, that's the
So I think what you're hearing, at least from us at the agency, and what we're trying to convey through all this is, these are all possibilities. It's all there. We are collaborating. We need to know, and we're willing to work with you to figure out how to get it done, right? I've said this a million times. About, don't wait for us at FDA to come up with a solution. This is well within your capability and your purview, or the regs allow you to do this. Help bring us along for the journey and educate us, right? But don't wait for us to be the ones to drive these types of solutions. You won't get that speed that you need.
Thanks.
All right. Maybe last 2 questions and then we'll close.
There's one
We've
online.
got some-
Oh, I'm sorry. We should go online. Yeah.
No, I think we'll give Cisco and Joe a break, and hopefully this is for our subject matter experts, O'Hara. I'm just curious your thoughts and guidance on, certain processes and, as you're looking at a digital twin, are highly dependent on human element, human repeatability, performance, and or understanding the human dynamic as a part of a particular, it's not going to be every process, obviously, but what are your thoughts on how do you approach that and understanding when you've got something in your system that is true and you want to make sure you're accounting for that and or modeling that correctly?
yeah. So all discrete event models that we typically design, and as part of best practice, are stochastic. So they will obviously always have a an element of randomness to them. So the long answer for that, I'll kind of summarize it, is essentially that you monitor human movement, you make a distribution based off of human movement, and then you take the distribution and put it into your model and introduce another random variable, and that should account for your stochasticity. And then over time, as your physical environment changes and it's feeding the information to the system, your model is changing based on the randomness that it's encountering in the real world, and then it just gets closed loop. The first time that you do it, you have to get that. You have to account for everything that you know, and whatever you don't know, that becomes your randomness. So then your model has randomness built into it, and then over time you want it to reduce the amount of randomness that you have, whether that's operationally or whether that's data that you're capturing. So I don't know if I answered that directly, but I can tell you more offline. Yeah.
Maybe we can have that online question. I don't know if you can put it back up. What is the connection between digital twin and digital thread? How does digital twin impact the cost of poor quality? So I'll have you guys maybe answer that. I do want to make one quick, because this is a pet peeve of mine. We need to stop talking about the cost of quality, the cost of poor quality, cost of quality. It needs to be about the value of quality. Okay, we need to reframe the way we talk about value. Okay, so happy to talk later about that. I know Steve and I had a good conversation last night about that. But anyway, sorry, go ahead on the digital.
I know you probably have a lot to say about
Yeah, I can answer it really quickly, basically. But essentially, the connection is that digital thread is the story of what's happening in your digital twin. So your digital twin will start when you want it to start. So either you want it to start a design or in manufacturing. It depends where you want it to start. But as your operations and or your product are moving through its life cycle, the digital thread is just essentially the history of what's happening to your product or to your manufacturing, right? It depends on what you're really trying to capture. And so that just becomes the storyteller. It just becomes the history of what's happening. And then for digital twin impacting cost of poor quality, if you have a digital twin and you're being able to figure out what to do first before you go out and do it, then you've pretty much impacted what could have gone wrong. And so now your cost of poor quality should, in theory, it shouldn't be there. I mean, obviously, it's hard to completely eliminate it, but at least you can approach reducing it and work towards elimination, right? I don't know if you guys want to add to that. But
Sounds right.
All right. We may run a little over. We got a lot of questions. Ravi?
Yeah, hi, my name is Ravi Nabar. I, first of all, want to thank Jason and Joe for clarifying that this is not really advanced manufacturing. But I also want to go back to Steve's kid size request for small and medium enterprises, where additive manufacturing and 3D printing is already taken root and is probably going to be the future for advanced manufacturing in many ways, not to mention the Internet of Things and the whole feedback loop that comes from testing and other sensors that are in the system. I also wanted to just mention, back in 2019 or so, I don't know, Cisco, was it 2019, early 2020? Cisco and I made a presentation on the connection between the digital twin and the digital thread.
That's 2020.
And one way of looking at it, how quickly time flies and we forget, is to think about, and that's a great question later, digital thread is a way of populating the digital twin, even from real-time information that's already present in legacy systems. And so data analytics forms a big piece of that. And I know we talked a little bit about that and how that plays back into a feedback loop. But I also wanted to just mention there's some great people here today who have done a lot of work in digital transformation. We've got MedLogic here, who's basically got a whole testing platform taken from the automotive industry that I think at some point we should probably think about how that populates the digital thread and the digital twin. And I'd also like to say, there's Larry Sampson here, who's literally leading a pretty large digital transformation, probably one of the largest and would love to hear more about what are the basic challenges that come with digital transformation. And then also talk about advanced manufacturing in the true context of advanced manufacturing. So any comments on that from anyone on, on that aspect would be very welcome. Thank you.
So I'll take that. In terms of the last question or the last comment first, we have the opportunity to bring the thought leaders and early adopters into, sessions like this, or even separate sessions where there are, dedicated time for you all to hear from those folks. And so certainly with Steve and Prakash, we can certainly make arrangements to do additional webinars and sessions. If you guys are willing to volunteer your time, we'd be more than willing to set something up so that you could hear more about this. In terms of the small company response or investment, from an overall MDIC perspective, back in 2021, when I first joined MDIC, the steering committee, we all talked about what's missing from Case for Quality. And we all agreed that there was a gap in the connection with small companies. And so from an MDIC, from a Case for Quality perspective, we've been looking for more and more ways to engage with small companies. From an MDIC perspective, it is now an imperative of MDIC to do more outreach. And what we've learned from the small, mid-sized companies or small companies is that what we do isn't necessarily ideal for incremental implementation. So as an ask to this group and to all of the groups within MDIC, think about implementing some of these solutions incrementally, because these small organizations, as we heard from Steve and from George, may not necessarily be ready for a full-blown implementation of a large-scale program, but they can incrementally implement. And so that's the approach we're taking with the Advanced Manufacturing Clearinghouse, is to work with companies that are doing this on an incremental basis. And as I mentioned, they have to make decisions about where to make their investments, and so we're willing to work with them on where the appropriate investments are. But we have to crack the code as to why programs that MDIC has provided hasn't been really implemented or embraced by those small companies. And we think we know what it is. We think it's all about making the decisions and where to make their investments, and so we need to unlock that. But that's our commitment to from MDIC perspective, not just a Case for Quality perspective.
Yeah. I'll make a quick comment. Maybe Larry Sampson from Alcon, if you wouldn't mind just standing up and saying hello to everybody. So to Robbie's point, Larry is the digital transformation strategy leader at Alcon, an $8.8 billion company. And this is public information. You talk about business case. So for their top 4 product lines, if they can shift left and really get that velocity of change moving, leveraging digital transformation, $250 million of top line. Okay, I said value of quality. That's a great example, right? How do we drive top line growth for the company? So I know we're over time, but Larry, if anybody wants to talk to him at a break, he's doing some really amazing things from a program management perspective with the way he's managing the complexity of all these different applications, all these different capabilities, all these different use cases. How do you integrate? How do you validate? It's huge what he's trying to do right now. So great person for you to talk to at a break.
Might just add to that too, this question about small company versus big company. I've worked everything from startups with 5 people to Siemens with 380,000 employees and Alcon with 25,000. The problems that we have in the big companies are problems that small companies don't have to deal with, right? You don't have 6 development centers with 1,000 products that you have to move into the system. I'd look for the low-hanging fruit, right? There's all kinds of opportunity in design control, just as an example, very inexpensive to get into. And if you think about it as the real investment is in the data, how much time you've put into the data. If you have very little data, that means you have a much lower cost of entry. So just a different perspective, right? I'd get started if I were in a small company.
Maybe one last question, Brent, because I know we're way over. That's okay.
Brent Roberts, Siemens Digital Software Solutions. Just really quickly to make one comment. Prior to Siemens, I was at W.L. Gore. I'm also a co-author on the white paper that was shared. But the piece that I wanted to kind of bring up is one of the barriers is adoption. Adoption within the organization of the people that are going to use the solutions that you're proposing. And one of the comments is how do you generate data? Great opportunity to create data is include the people that you're trying to educate on the direction you're going in something like a live simulation lab. So take a peek at the white paper, look at the idea shared in there on a simulation lab. The actual operators that are going to use your solutions at a later date are generating the questions, the comments, and the new sets of data as you're installing, as you're implementing, as you're evolving, right? And so it goes back to exactly what Zohair said is that bottom line. It's about the people. When you make your solutions about the people as well, they get really excited and they want to have more of these solutions available to them, and you cross one of the biggest barriers. So I guess more a comment than a question, but offline, happy to discuss anything that you'd like.
Great, thank you.
Bren came out of Intel, 15 years, 16 years at Intel, and then was at W.L. Gore he was the VP of Supply Chain Strategy for 5 years and was the executive sponsor for their MES program. That's all spelled out in that white paper. But again, a great example of organizational adoption, right? Using the simulation lab to get the operators and the engineers really engaged. And when they went live, they were able to go live very fast because of the engagement they had with the employees. So I know we're past. Maybe any last takeaways from the panel?
I think we covered quite a bit. I think the value here is really to share those use cases to get involved. And we have some work to do. Again, we launched the program recently. We've got the webinar coming up on Monday to talk a little bit more about the process for those folks that are just getting in aware of this program. But this is not a one and done. Like I said, we're starting this journey, and with the partnership from the agency, this fits right within what we're trying to do is with in terms of transforming in the industry as a whole. And so, when you talk about service providers, you talk about solution providers, we also have some opportunity to work with you guys as well from a council standpoint, where we want to hear what you're hearing so that we can then continue to make this program even better.
Yeah, so great conversation. We're out of time, apparently. So I think I want to be respectful of that. We can chat offline and everything else, but I think it's just, we can get started. We're here to collaborate.
So Harry?
I would just say thank you very much. It's been an honor to be here. So my only thing will be that after we're done here, which is now, is
6 minutes ago.
Sorry, 7 minutes ago now. Yeah. Is just to be able to talk with everybody and collaborate, because I think there's a lot to be done together. So
yeah,
I'm excited.
I'll just add with a quick quote, my favorite leadership quote of all time. All great leaders have a healthy disregard for the impossible, and they lead with integrity. Right? I don't know who said it. I heard it in college at a 6-day leadership session I was in, but I love that. I love that middle part. Healthy disregard for the impossible. And that's where I see this program going. Imagine in a few years modernizing the way submissions are done, modernizing inspections, right? We're so far behind in the medical device and diagnostics industry compared to all these other industries. So please have a healthy disregard for the impossible as we move forward. Thank you very much to the panelists. So.